Dr. Fox does a good job at delivering babies.
Never drop.
Good job.
Sometimes you gotta do that to get them started breathing, you know, but.
Welcome everyone. Happy Independence Day weekend. Today we have a small panel, but this is all we need to get your your questions answered. We have Dr. John Fox and Rachel Smith, BSN, with us today to answer your questions. We do have some brief topics to go over. As usual, the beginning of the month, or for the last couple of months, we've been beginning new phases of the Governor Polis's orders for reopening our state. So today we're going to talk a little bit about the protecting our neighbors phase, as well as staying safe over the 4th of July weekend, and wearing our masks. So if you have any questions, please put them in the comments and we'll get them addressed. Thanks so much. The first thing we're going to go over today is the protecting our neighbors phase. Colorado, the governor released for Colorado a framework on what that means. It's moving forward. It'll give communities that can demonstrate strong public health and healthcare systems paired with low virus levels, which is what Lincoln County demonstrated so thus far. We can take more control over our reopening plans. It gives us more control at the community level. And it does mean that different parts of the state will be looking at different phases of reopening based on our local conditions and capabilities. This plan has to be applied for by our local public health director, Joe Beth Mills, and it requires collaboration amongst many different organizations in our county. The hospital is a big part of that. We as a hospital have to have sufficient hospital bed capacity. As we have spoke about before, we do not have an ICU or ventilators here in our hospital. However, we can manage a 20% surge in hospital admissions or patient transfers, so we do meet the requirements for that. Is that right? Am I saying that correctly, that we could handle that? And then a sufficient PPE supply. So Rachel, what does that mean, the sufficient PPE supply is 2 weeks is what they require for the plan.
Right, so all that means is that when you identify that you have a surge, obviously you're going to utilize more resources, so you have to be able to keep your staff and patients safe in the event that a surge would happen. We currently have 120 days worth of PPE, but that's general operations. So we feel very comfortable right now that 120 days of general operations would be adequate for a 2-week surge if and when that potentially would happen.
Perfect, thank you. So the second part of the qualifications are cut into 3 parts. So those 2 things that we just spoke about are treatment. The next is transmission. So stable or declining COVID-19 hospitalizations kind of doesn't apply to us. However, none of our 4 cases have been hospitalized to date. Dr. Fox, tell me what you were talking about with our infection rate here in the county.
So when we talk about infection rate, we talk about if you have coronavirus, how many other people do you give your coronavirus to? So, you know, if one person gives coronavirus to one other person, that person gives coronavirus to one other person, the infection rate is considered to be 1. If one person gives it to 4 people and those 4 people give it to 16 people, that infection rate would be considered to be 4. Obviously, to keep numbers level, your infection rate needs to be right at 1, and that's actually what the rate is currently in Colorado. If the number is above 1, then you're going to see numbers, the number of cases within your county, state, country, whatever, you're gonna see those numbers go up. In the United States, there are now 36 states that see numbers increasing, and the state with the highest rate of infection is actually Nevada, and their number is 1.56. So for every one person with coronavirus, they give it to 1.5 more people, if you will. Interestingly enough, the state with the lowest transmission rate, and remember, 1 keeps you level, higher than 1 makes you go up, lower than 1, you're going to see your numbers slowly decline and ultimately disappear over time. The state with the lowest transmission rate in this country right now is Massachusetts. There's a little town in Massachusetts called Boston. I don't know if any of you ever been there, but there's a ton of people there, and they're pretty darn close together. But the infection rate in Massachusetts is the lowest in the country, and it is 0.81. So their numbers are actually headed down. What does that mean for us? It just means that we need to continue to be cautious. We need to continue to take the appropriate steps to protect not only ourselves, but those around us. You know, if we care about our neighbors, we need to be wearing masks, we need to be washing our hands, we need to be maintaining social distancing.
One thing to add to that, Dr. Fox, when we talked about this, you know, kind of when all of this started, it's not necessarily you wearing your mask to protect yourself, but remember that if you're the one that acquires coronavirus, when JoBeth contacts you, she's gonna ask you who all you've been in contact with since you started exhibiting symptoms and prior to that. And you want to make sure that you're able to tell her and be comfortable telling her with how many people you potentially exposed. So when we talk about wearing masks, and we're, you know, really adamant about, you know, wearing them here at the hospital and encouraging you to wear them elsewhere, that's why. Because it's not just you that you're potentially exposing and infecting, it's everyone else around you as well.
And remember too, and this is basic epidemiology, 40% of a population has to be immune to an illness for that illness to level off. And that's if no one's doing anything in terms of protection. There are a lot of people out there that say, oh, well, you know, there's all these people that really have it that were asymptomatic, never got tested, so the total number of cases, we're really, really low in terms of our estimates. You need to know that even if you said, okay, for every 1 person that tests positive, there's 11 more that have the disease and did not get tested for whatever reason. So that's 1 in 12. Even if you use that estimate, and most epidemiologists are using the 20 to 40% number. Obviously, 1 in 12 is a lot higher than 40%. But even if you use that number, the best we come up with is about 9% of people in the state of Colorado that have had this disease. Again, we don't level off till we're 40%. We don't start seeing numbers go down until 70% of people are immune. And again, that's without taking the precautions. We can impact that sooner and not have that many people actually get sick if we will wear our masks and wash our hands. So
exactly right. I'm going to run through these qualifications for the Protect Your Neighbor. Again, it has to be applied for, but just to give you guys an idea. And then we have some other topics and some questions to address. Fewer new cases, so we talked about that stable, no greater than a 25% increase. Fewer new cases, this is under the transmission metrics. So for a county our size with less than 30,000 people, no more than 7 new cases within the last 2 weeks, a 2-week period. So as of right now, we meet those qualifications. However, there are several tests out right now. Again, we're not immune to this in our county. There are possible outbreak potentials that can happen. To this date, Joe Beth said that they have tested 218 members of our community, which barely scratches the surface. And then the third part of these metrics to qualify for Protect Our Neighbor, I'll just run through them quickly, is sufficient testing capabilities. So that the county or our region has the capacity to test 15 people per 10,000 residents per day, which we can easily meet. The ability to implement case investigation and contact tracing protocol, that's something that Joe Beth deals with on a regular basis. Documented surge capacity plan for case investigation and contact tracing. Do you have anything on that? And documented strategies to offer testing to close contacts. So that's when you may have been in touch with or in contact with someone that is a confirmed positive case. So that's just to give you an idea moving into that next phase.
Megan, I just want to mention about the testing. So a week or two ago, we were able to do a test and get results back within 24 to 48 hours. Because of the surge in testing, it's now taken closer to 4 to 5 days to get results back. And so just an FYI, in some places, one of the reasons this is important to us is some places are requiring that you have a negative test before you go have elective surgery. So, we were doing them, the closer we get to the time of surgery with a negative test, the better it is, because there's less time for you to pick up the disease between the time you're tested and the time you actually have surgery. If we have to lengthen that time, there's more risk of you contracting the disease between the test and the time of surgery. Plus, if test results aren't back, your surgery's canceled, and that sort of sucks when you've been waiting for it for the last 3 to 4 months. So just be aware that the testing is running behind, and this county right now probably has somewhere in the neighborhood of 30 to 40 tests that are out there that we don't know the results of. So yeah, we only have 4 cases, but that could change in a heartbeat.
Right. And that kind of brings us on to our question here. Jackie, thanks for your question. She said, when can we start scheduling visits in the care center? Governor gave the okay as of July 1st, and that is true. The state has released new guidance for residential care facilities for outdoor visitation. That our team is discussing that, talking about weighing out the risks and creating a plan. It does have to be quite an extensive plan if you've looked at the guidelines that the state has released. So we're talking mid-July. If those tests that Dr. Fox just mentioned come back where we have an outbreak in our community, there will not be visitation in our care center, unfortunately. We have to protect our vulnerable population. There are end-of-life situations. Every case is considered on a case-by-case basis. We're not applying the same rules across the board to anyone because they don't apply to anyone. So if you have any questions regarding a care center resident or our assisted living resident, please contact either Erica Safford, Tanya Lindley, or Carrie Owens here at the hospital. They'd be happy to talk to you about it, talk to you about what our planning process looks like, and believe me, we want to make this happen as much as you do, but we want to do that in the safest way possible. So right now, we can say July 15th, I don't know what day of the week that is when we would start to open that back up around that week there. Going back to, we were talking about the spikes in other states, and something we kind of want to touch on is that not only is there spikes among young and healthy individuals, and these are confirmed cases, whether they're asymptomatic or if they are experiencing symptoms, but Dr. Fauci was stating that we're seeing an increase in hospitalizations in people aged 20 to 40 years old, which has not been the case until now. So our greatest concern here is the asymptomatic affecting people, like you said, Rachel.
So I'm not as concerned about the fact that they're asymptomatic during the 2-week period, but one of the things that studies are finding are the kind of the comorbidities and the symptoms that happen, a month after you potentially have been infected. We've seen multiple case studies that, it's not just a 14-day disease. This is a disease that affects you for a very, very long time. And sometimes the aftermath of, kind of that respiratory cough, initial illness is much, much, much more extensive. I don't know if you have anything to add to that, Dr. Fox, but.
Yeah, my partner Brianna Fox was talking about a relative of hers, a young lady in her 30s with absolutely no underlying health issues. No asthma, no heart problems, no diabetes, no high blood pressure. She's not overweight, she's healthy, she works out. One of those people that you look at and you say, they won't have any problems with this disease. And in fact, she didn't even know she had it until she started having some unusual, headaches and just kind of weird neurologic symptoms. And the fact of the matter is that when they finally figured out what was going on, she got tested. She had coronavirus, and she now had blood clots in her brain. So to say, oh, it's okay, don't worry, most people are going to be okay. If we don't take care of our own, if we don't stay healthy in this county, if we don't wear our masks, if we don't wash our hands, if we don't social distance, if everyone in Lincoln County got coronavirus, we would see 269 people die. We would see over 1,600 hospitalizations. It's not a benign disease.
Sorry, I keep interrupting you.
Go ahead.
To put that into perspective for you guys, and just to use the words so we can really get those buzzwords out of our way, this is herd immunity that Dr. Fox is talking about. So we just let it run. We've all heard it. It's time to let herd immunity take place. Let's just let everybody get it, let it run its course. These are the numbers. How many deaths?
269 deaths in the county, 1,683 hospitalizations in the county. And based on and that's just based on a normal age distribution population. Based on our age distribution with a lot of older people in and around this area, those numbers could actually be a little bit higher than that. But it's not something I want to see, I'll tell you that. Immunizations, there's a bunch of them out there in research and development. Some of them have entered stage 3. I would love for us to have something this fall. Realistically, we're probably looking at June of 2021 until we have something that is available to the general public to help with protection. The antibody question, if I've had it and I have antibodies, do they protect me? Do they not protect me? There actually have probably been more questions that have come up about that than answers in the last several weeks. There's some thought that even if you don't have antibodies, you might have some protection. There's a thought if you do have antibodies, you might not have protection. I'm going to go back to what I said early in this process. You need to act like every person you come in contact with is infected and everything you touch is contaminated. If you have that mindset, you markedly reduce the risk of getting it yourself. You markedly reduce the risk of spreading it or giving it to anybody else.
Perfect. Thank you, Dr. Fox. So we do have a question from Emily Green. She says, My husband, 4-year-old, and I are going to a scheduled lake house at the end of the month with another family of 3. Both families will have been self-quarantined for 2.5 weeks. Will we need to wear face masks around each other while at the lake house?
So the answer to that question is probably not. But understand that even at a secluded lake house, you may be around other people, or you may end up coming into contact with other people, either say down at the dock, or if you go out to eat, or those sorts of things. So even though you may intermingle in that 2-family group relatively safely, you still want to have your protection with you. You want to have your mask, you want to have your soap and water, your hand sanitizers. Yeah, no, I know it was secluded, thank you. You want to have your soap and water, your hand sanitizer, you want to have your masks available, gloves maybe, just in case you run into a situation where you need that protection. I'm a big fan of fishing, so I like secluded lake houses, believe me. And I have that exact same protocol in place for any groups or any people I go fishing with. So yeah, I think, and actually I think you did it really smart, so kudos.
Okay. So that kind of brings us to the 4th of July plans that we have happening locally here in Lincoln County. Flagler, as part of Kit Carson County, has had their fireworks canceled due to the fire ban. So there's definitely some safety precautions that will need to be taken there. But Lyman on the 4th of July does have a 5K fun run. The Tamarack Golf Course does have a tournament planned. I have an 8-inch hole par 3 planned. It's a 2-person with social distancing aside from your partner on that. And then the museum will be open from 1 p.m. to 7 p.m. There are 2 movies scheduled at the Lincoln Theater, and there will be fireworks at dusk. You just have to watch from your car, home, or you're welcome to watch on Facebook Live, as that will be streamed live. Hugo will have fireworks at dusk at the Lincoln County Fairgrounds, and it will be pretty much the same as it usually is, tailgating from your own personal vehicle. However, the intermingling will not be the same as it usually is on previous years. So those are really safe ways to go out in your community and celebrate. But if you will be attending barbecues, we saw these surges that were directly related to Memorial Day celebrations. So is there anything that either of you want to kind of touch on for that?
Wear your mask, wash your hands, keep a safe distance. That's right now, that's what we can do, okay? I wish we could do more.
Right.
Someday we may be able to. Someday we may have immunizations for all of you. Someday we may have pills for all of you. But right now, all we can do is wear masks, wash your hands, keep a safe distance. It's the preventative stuff.
So we're at about 60% or 60%
They were just talking about the theater being closed, and Troy just mentioned it's a rental period. So the Lyman Chamber of Commerce is actually, the theater is closed because the Lyman Chamber of Commerce is renting it to do the movies this weekend, is what it sounds like.
Yes, there will be private viewings of older movies, but family friendly at 2 o'clock, and at 6 p.m. there will be, I don't want to say adult movie, because that's not the right message, but a less family-friendly film, no nudity, I believe.
Oh, boy.
Some violence is the reason why it's not a kids movie.
All right, Lyman Town Council, be ready. You're gonna have to talk about this.
Yeah, I want to hear about that one. It's pregnancy brain, I'm sorry, I don't have any better word. I think that's all we've got for today, unless anybody has any last minute questions. I want to thank you guys for joining us today. Thank you, Rachel and Dr. Fox. We appreciate your time as always, and everybody stay safe this weekend so we can continue to reopen our county.
I want to leave you with one of those really deep thoughts, okay? And this comes from one of my patients this morning. Now, I can't tell you who it is because that'd be a HIPAA violation, but I'm going to steal his words and because I think they really, really apply. We'll never know if we did too much. We'll only know if we did too little.
Yeah, that's great. All right, well, thank you all. Have a good one.